Hi, I am Olga Gross-Balzano with BerryDunn Healthcare Group. And today, my colleague Melissa Baez and I are going to talk to you about Medicare bad debts and what every skilled nursing facility needs to know to optimize their available Medicare reimbursement. So what are bad debts? Uncollectible Medicare deductible and co-insurance amount for covered services that are reimbursable under Medicare program could be included on Medicare cost report as cost of uncollected fees. Medicare amounts that were determined uncollectible after reasonable collection efforts and unpaid balances for Medicare, Medicaid dual eligible beneficiaries. So what that means, we will reemphasize that a number of times today, is that Medicare should have processed the claim, allowed the charges, and you're writing off the portion that is for copay and deductibles for paid Medicare claims. Melissa is going to talk more about why we are discussing this topic, why it's important to providers.
Hi, I am Melissa Baez in BerryDunn's Healthcare Group. Continuing our discussion on bad debts, the only mechanism for skilled nursing facilities to get reimbursement for bad debts is through the Medicare cost report. Allowable bad debts are reported on Worksheet E in different sections for Medicare Part A and B. Currently, CMS is reimbursing facilities 65% of allowed bad debts, less sequestration if applicable. For purposes of this discussion, the data on your screen represents reimbursable bad debts for Medicare Part A, the net reimbursement facilities are receiving as a settlement. BerryDunn maintains a database of skilled nursing facilities as filed Medicare cost reports nationwide. We analyze data annually, looking for trends and opportunities to help providers optimize available reimbursement. Cost report data shows that in 2018 through 2020, on average, 75% of facilities nationwide reported allowable bad debts and claimed, on average, close to 63,000 of reimbursable bad debts for Part A. To compare facilities of different sizes and Medicare utilization rate, we also show bad debts on a per Medicare patient day basis. As you can see on the bar graph, per patient day debts are climbing up in all regions, averaging $19.43 in fiscal year 2020. So understanding requirements for bad debts and utilizing this reimbursing opportunity could significantly help your bottom line and financial indicators. Now let's talk about requirements. CMS has standard form for providers to fill in and submit with the cost report. This form reflects the requirements for bad debts to be allowable. Let's take a look at the criteria. The debt must be related to covered services. That means the facility should have billed Medicare A or B, and claim would be processed for payment. Bad debts include only deductible and coinsurance amounts. You should refer to the remittance advice to confirm these amounts. Facilities cannot include outstanding balances related to rejected or suspended claims or amounts denied by Medicare. The provider must be able to establish that reasonable collection efforts were made. For dual eligible Medicare and Medicaid beneficiaries, providers need to include Medicaid ID. For all other claims, facilities should have followed its standard collection procedures. The debt was actually uncollectible when claimed as worthless. That means these balances should not be listed with a collection agency, and your organization has written them off during the cost report period.
Melissa, can we go back to the previous slide for just a moment, please? Thank you. So actually, if you look at all the headers, at all the required fields on the Medicare bad debt log, you will be successfully completing all necessary information, because it does ask you for dates of services. It asks you for Medicaid number. There's a field asking you for date collection efforts stopped, so that is the date of the write-off. And it also suggests Medicare remittance advice dates to make sure that you are looking at those remittance advice and making sure you're only including allowable charges. And then you have columns for deductibles and co-insurance. So this log does guide you to complete all the necessary information and prevents you from including anything that is not allowable. Thank you, Melissa. Can we go to the next slide, please? So now let's talk about Medicare bad debt checklist. What you currently see on the screen is not our checklist. We actually have a nice form that you can follow with your staff. But what it does include is it has reference to regulatory guidance where you can find out what CMS is allowing for bad debts and what information you need to have as a support. It also outlines all the requirements for claims that could be included. And it has some guidance on completing the log, such as reviewing for accuracy. For example, if you are writing off co-insurance for inpatient claims, you know what the amount that Medicare is allowing for co-pays per patient day. So the total amount you're writing off for that claim cannot exceed the amount of daily co-pay times the days in the claim. And then we wanted to remind you that all required support needs to be in HIPAA compliant storage and transmission mode because it does have patient names, identifiers, so it is sensitive information. And again, you can download BerryDunn checklist on our website. Melissa, back to you.
Thank you, Olga. Thank you all for attending and watching our video today. We hope you find this information to be helpful. To the left-hand corner on this screen, you'll see a link to the checklist. You can click on there and it'll bring you right over to the checklist to get some more information. And below you will see Olga and I's information. If you have any questions, feel free to reach out to us. Thank you.
Thank you.